All right, awesome. So we're live at the moment. So you can always go back later to really revisit today's meeting. Thank you. All right, so you can always get back to the YouTube to really watch the session over and over again, because I promise that a lot of insight will be shared on today's call, and it's something you always want to have at your fingertips. So we've got you covered. It's been live streamed on Digital Health Africa YouTube channel, so you can as well go there after today's session to revisit and catch up on what has been discussed today. All right, awesome. Let's keep the introduction going. And today's opening session will be exploring the topic Introduction to Digital Health Ecosystem and the Industry Trends. So this particular session is the first in series designed to empower young professionals, students, enthusiasts, policymakers, IT experts with the knowledge, tools, and connections to pursue a fulfilling career in digital health, right? So whether you're just newly coming into the space, or you are currently in the space and you really want to grow in your current role, we've created sessions to provide valuable insights directly from industry leaders, right? And today we have, top-notch speakers, panelists in our midst who will be introducing us to the, digital health space, because this space is very dynamic and is rapidly evolving. So navigating career opportunities might be challenging, right? So this series, this Launch Your Digital Health Career series itself, is designed to be able to provide you insight into the industry landscape and the skills in demand, as well as highlight opportunities, career opportunities for you, so that you can decide based on your interest and passion where you really fit in the ecosystem, and also connect you with professionals and opportunities that can shape your career. So in line with this, allow me to introduce the organizers of this webinar series, which is Digital Health Africa, in collaboration with Innovate Health Africa. So at Digital Health Africa, we are a non-for-profit leveraging media and publication strategies to drive positive change in the healthcare landscape. We're a little above 1 year old at the moment, and our aim is to ensure that we empower the ecosystem with insights and information to be able to make informed decisions, and also to be able to keep up with the trends within digital health space. We also host the largest network of students innovating and researching in healthcare through our Africa Digital Student Network. I'll quickly call on Oluwatobiloba to introduce Innovated Africa, and we get right into the discussion. Over to you, Tobiloba.
All right, yeah, thank you very much, Vivian. Could you just confirm you can hear me?
Yes, we can hear you.
All right, thank you very much. Once again, we are glad to warmly welcome you to the launch of our web series of the night. Yeah, Innovated Africa is a non-profit organization where established to accelerate the transformation of healthcare in Africa, majorly by building future-ready workforce, capacity development, and fostering partnership for innovation, and working with communities to design solutions that enhance access, quality, and outcomes for everyone. So this are the key area uh, that we carry out our work. So as part of our digital capacity development initiative is where this partnership with Digital Africa lies. Together, we have brought to you this webinar series, and we hope that you will have a good time here. You will be able to make intelligent decisions on your digital career. Thank you very much. I wish you a happy learning.
All right, awesome. Thank you so much, Tobiloba, for the introduction into Innovated Africa. So the objective, as I've mentioned, for this webinar series is to ensure you all who are really interested in this space, who want to innovate in this space, who want to contribute your skills, your passion, you have a good foundational understanding of the digital health industry and its market needs. You're able to expand your professional network through connections with industry experts. You're also able to identify your career opportunities that's aligned with your interests and expertise. So we have a career fair, which is coming up amongst the event series lined up. And lastly, to enhance your professional profiles with CV and LinkedIn optimization, which is also one of the sessions that are going to come up within this webinar series. So, all right, to today's session, which is the opening session, I think it's just really important for us to understand the digital health ecosystem, the industry trends, because it's good to have that foundational background, especially for those who are newly coming into this space or those who are even in the space already, but have that knowledge gap to really understand what this ecosystem is all about. So we brought to you speakers who are well versed, who are experienced within the ecosystem, and we are happy to have Zila with us, someone who is deeply engaged with the health tech, digital health ecosystem through our work at Salient Advisory as a consultant. Hi, Zila. We are glad to have you on the call today. If you can say hello to the participants and our audience.
Hi, Vivian. Hello, everyone. Thanks for having me. I'm happy to share my 2 cents.
I'm sure we'll have more than 2 cents from you. But yeah, that's great. Yeah, so up next on our panel list, it's Sylvia Mugamya, who is a senior digital health business analyst at Rwanda Ministry of Health, who has led the implementation of Rwanda Healthcare Digital Transformation Strategy. And we believe through Sylvia's insight on the call today, we'll be able to have a deeper understanding into public-private partnership. How does digital health implementation really happens, right? And what are the gaps in terms of challenges faced, and where you, as an healthcare professional, someone interested in the space, really can add value and fit in. Hi, Sylvia. We're happy to have you on the call today.
Hello, everyone. I'm happy to be here. I'm happy that we are going to be running together. Thank you.
Thank you, Sylvia. Thank you so much for your time. We are really grateful. All right, so let's just let's get into the discussion right away. But before we kind of deep dive into the questions we have our panelists today, I just want us to take 2 steps back. I know it's a new year, we're all excited about the year, but I think we really need to go back to 2024 and really ask our speakers, like, based on your perspective on the digital ecosystem in Africa in 2024, what were some of the key highlights or milestones in this industry in 2024 that stood out to you? So in terms of investment, in terms of government partnerships, we saw some countries that validated their national digital strategies, some that passed things into bill. We're seeing partnerships here and there from the government with private stakeholders and all. So based on your perspective, let's just look back a bit before we start talking about 2025. So let's take a step back and look at 2024. Zila, from your perspective, what were some key highlights for you around digital health last year in Africa?
Yeah, I think when you were even doing your introduction, you said something about how the digital health space, especially in Africa, is evolving. And everyone knows that 2020 was like a pivotal moment in digital health. That's where we saw this rapid influx of new startups. But what stood out for me last year, 2024, is that I think we got to a stage where we are now looking at impacts of these solutions, actual impact, how the impact they have on the healthcare systems, and even in terms of government partnerships and government actually putting forward regulations, just to guide their operations. The pivotal moment for me was, I think, the Africa CDC launched a health tech marketplace where vetted digital health solutions that have shown will I say, that have shown the proof of their concept and have actually the impact that they've had has been seen and realized can actually sign up, And so we have that platform where we have this list of solutions. So I think we are coming to a place where it's no longer, obviously there's still room for innovation, but now is how can we mainstream these innovations into routine healthcare practices and see government actually take ownership and leadership in driving this. Really, really impressive. And if I want to give a shout out, I would say Rwanda government and even Nigerian government too was really impressive.
Oh wow, yeah. Thank you so much for the shout out. Yes, I think you really made incredible points. And even if you look at the number of digital health apps that were launched, if you look at the growth, there is a sharp decline in terms of the number of digital health apps application launched globally. And we're beginning to see that we need quality over quantity, right? So I think that really reinforced the points you mentioned about impact, like which solution is actually solving the problem. It's no longer about the hype or the excitement. Now we're looking at the value and the impact of this solution. So thank you so much, Zila, for pointing that out. So I'll go for Sylvia now to really ask about his own perspective. And Rwanda is in the spotlight at the moment, and they're doing amazingly well in terms of innovations. So, what was the key highlight for you as a digital health practitioner, as a specialist, and someone working even within the government agency?
Yeah. Thank you. Thank you very much for a good question. Actually, to summarize the year, it may not be easy, but let me put it in this way. It was a year where we had like the same voice, the same understanding in the Africa. I've attended different conferences in this 2024, and have realized that what we have been dreaming in Rwanda and what we have been trying to do in Rwanda, it is now becoming like the whole idea, the same idea for everybody. And I was very happy for getting to know that at least all of the people they are now towards seeing how they can make digital health public infrastructures, and also making the patient unique, understanding the patient-centered methods, not always being vertical, thinking about programs, thinking about diseases, thinking about digital apps. It has been a while where people think about, no, I need to create an app for HIV, I need to create an app for a kind of disease. But I've realized that people are also moving from that side to the side of thinking about ecosystem, and that's for me. It was a very strong highlight for the year, and the year ended when we were in a global digital health forum, where it was
Yeah.
also again emphasized on creating the solutions that can be shareable, that can be reusable, not always having new apps, new solutions, but seeing how can we reuse what is existing, and how can we make sure that they can talk to each other what is existing. So I think in Rwanda, there will be many highlights because we have been completing the development phases of different projects, and we have also started the implementation, so which is a very huge stage. But at least in 2024, it was the time that we completed the development of Rwanda Health Information Exchange. We completed community health information system. We completed health post information system. We completed the development of electronic medical record, our own one. So you can understand. So now we are like starting deployment. We are starting the implementation, which is also a huge stage, but at least the development is like now giving us products, and now we start implementation. Thank you.
Wow, that's really impressive. Thank you so much for highlighting those key milestones, even from Rwanda, moving from implementation now to deployment. I think these are the kind of progress we really love to see within the ecosystem. And talking about the ecosystem, you mentioned that we are now beginning to have the same understanding. It's like everybody's now on the same. We have aligned that we need digital health. It's no longer a matter of vision is now a necessity, something we need to have. Having seen the effect of COVID and every other pandemic that has come in place, we've seen how healthcare innovations can really bridge this gap. So thank you so much for our speakers sharing those key highlights in 2024. And we hope that by the end of 2025, we will have more highlights to share. So let's go deep now into really understanding the ecosystem. For somebody who is newly coming into this space, an healthcare provider, a doctor, a nurse, a pharmacist, someone who is interested in innovating in the healthcare space, and as an African, from Zila, let's hear from you. So as an health tech investment analyst, when we say the word digital health ecosystem, what does that really mean? Right? Because these are the words we throw around a lot of times, like a buzzword now. But what does that really mean, and how does investment really shape this ecosystem?
Okay. When you hear digital health ecosystem, for me, it refers to the actual digital innovations and solutions like the telemedicine apps, online pharmacies, what have you, the infrastructure, the stakeholders, including the patients, obviously, the services that are being delivered through these platforms, and even the regulatory frameworks that are in place to just optimize healthcare delivery processes while also improving healthcare outcomes for patients and the general population at large. And obviously, in terms of the digital innovations, we have the consumer-facing innovations, which are like the online pharmacies, the telemedicine, maybe personal health insurance, and other like mHealth apps. And then we also have the ones tailored towards more like the healthcare providers and administrators, or even system managers, if you would say, like EMRs, order and inventory management, and even clinical decision support systems. And so that all of that, I would say, refers to like the digital health ecosystem. And now when you're talking about investment trends, I mean, just like any other industry, funding and investment definitely play a key role. They help to drive the entry of startups and even established companies into like the sector to develop and scale these innovative solutions. Just like I said earlier, during the pandemic, there was this influx of telemedicine and even online pharmacy apps. And obviously that was driven by the demand for this type of services. And obviously we saw investment towards this type of companies increase, just you would expect that. And so even as these new companies were actually maybe testing out new concepts, or even as they were scaling operations, next thing, what did we see? Government said that, okay, we need to regulate this space. We started hearing about online pharmacy regulations. I think Nigeria, Ghana, Rwanda, even South Africa, they're coming up with their own online pharmacy regulations, and obviously that's an area that I would say investment trends help to shape. And even now, as we are seeing this funding decline, not just in the healthcare sector, like globally everywhere, what are we seeing now? These health tech startups is either they are shutting down or we even hear of the laying off of like staff, like winding down their operations, or even merging. So we are seeing this consolidation happening now, not just like my colleague was saying. He said there's now everyone being aligned. We don't need more solutions. So there's this consolidation that is even really happening right now. And so this also investment is like, I would say, it's acting like a catalyst and even a corrective force, if you would say, influencing actual innovation, regulations, and even just the overall evolutionary trend of these companies. Yeah.
All right. Thank you so much, Zilia, for really helping us understand what we mean by the word digital health ecosystem. Because when we say that to some people who are not like maybe really within the space, they might have a vague idea or it might mean something else to them. So Zilia have said that ecosystem, it's a combination of different moving parts. She has talked about the infrastructure needed to run the digital health applications, then the applications themselves, both for the consumers, the patients, and for the healthcare provider side, as well as system management solutions and the like. So all of these things is what we call digital health ecosystem, and even the stakeholders who are involved in the industry. And thank you so much for sharing, the impact that investments tends to have concerning, building and shaping the ecosystem. So I will ask CVN now that with the current initiatives you have going on in Rwanda, still around ecosystem discussion, the one patient vision you have, you've been able to digitalize some community health services and all. What will you say are the key building blocks of a thriving digital health ecosystem? Like, what will you say are the key building blocks? Like, okay, if you put this and this in place, then this ecosystem is going to thrive.
Thank you. Thank you for a good question. And I thank you that at least you are talking about the ecosystem, because I've been struggling, like fighting with people talking about system, because for me system is very simple and small, but the ecosystem is more than that. So in order that you can have an ecosystem working, the digital health ecosystem working, so you need to put in place the interoperable health information systems. So if you do not have this kind of standardization, you do not adopt the common standards like HR7 FHIR, in that case, you will not be able to ensure the seamless data exchange. And this will really be a hindrance for you for making your ecosystem working. So you need to think about the integration. Integration in terms of systems at the hospitals and at the health facilities. So we should stop doing these vertical systems. We should not be happy to praise the stakeholders because he's much concentrated on TB, on HIV, or on a given malaria or something, and we praise them with their digital tools. So we should do an integration of the systems. I mean, having the system working together. We need to unify patients. The unified patient identity, it is very, very important for you to have an ecosystem working, because at the end of the day, we are working for a patient. And this patient is moving from, and the same patient with malaria is the same patient with TB, HIV, and other diseases. So we need to unify patient. That's a very, very important building block that we have to have on the ground. Digital infrastructure, we need to have cloud. We need to use some cloud. We need to do some connectivity. We know that the digital will not be digital if there is no connectivity. So we need to make sure that at least we have the all connectivity to all our patient, and until the last mile connect. Last mile point.
Yes,
So we need to ensure the security of the data. That's a very huge milestone. And it should be a building block that at least we make sure that whatever data we are collecting, we are digitalizing, it is very secure with the privacy regulations. So we need to engage patients. Sometimes we do digital, but we forget patient. We do not engage them. We forget that they should be accessing, they should be benefiting what we are doing. And this can be through patient portal, can be through mobile apps. So we need to engage them, and we need to keep the continuous communication between patient and healthcare providers. So we need to do something on workforce. I think this part of workforce, it has been really forgotten. Some people think we have very good digital health experts, but we do not have. I can give you an example. In my country here in Rwanda, it is a problem. We have a problem of healthcare providers. So they are trying to make something they call 4x4, multiplying by 4 the number of healthcare providers in 4 years. So, but my thinking was like, what about digital health experts? Do we really have enough digital health experts? So if you go around the health facilities and the institution, they are still using ICT and IT people as a digital health experts. And for me, this is totally different. A health informatician and an IT and information technology staff is totally different people. They are from different domains. Yes. some people use them interchangeably, but it may not be the case. So we need to also build the block of workforce, and this is very, very important. So we need to have intersectorial collaboration. In Rwanda, we are succeeding because the sectors are working together. You can't imagine. I'm sitting at the Ministry of Health, working for the Ministry of Health, but I'm paid by the Ministry of ICT. So, and my both ministers, Minister of ICT and the Minister of Health, bi-weekly they sit together and say, what are the works that is being done by this team of Chief Digital Office where I belong. So, and then they give us the instruction of what to do. The Minister of ICT can understand where the ICT things, Minister of Health, he understands where the health impacts and all of that. And when they are sitting together, that's what we call intersectorial collaboration. And we are called shared staff. And this kind of shared staff, shared services, so it makes all people working together and you can succeed. You need to not forget the policy and the governance. Anything cannot happen if we do not have very good policy and governance. So we are all doing whatever we are doing because we know that our leadership understands. If I say digital, I need to do this digital, they say, no, no, no. You don't need to ask, just do it. You see, that governance of like a willing, like a political will, like a support, that is very, very important for as a building block for an ecosystem to succeed. So another thing is innovation. It will not always be good if you forget that there is people who can give you solutions. For us, as the country, as Rwanda, so we have realized that we can create a pool where we can get digital solutions, and that's why we have from Health Tech Hub. We have a Health Tech Hub where the innovators they come, they sit, and then I go to present to them the problems that the Ministry of Health is facing. I present the problems, they innovate, they look for solutions, and then at the end, I need to acquire their solutions. We have put in place the policy. The policy is called Procurement for Innovation. So our innovators, we know that they cannot compete with our well-established companies. So that's why we cannot put them in the procurement. So we have created a policy that helps the innovators that if you have a solution, I will be able to take it without a competition. I will not put you in the competition with a well-established company because I will not succeed at the end. And then I can get your innovation used in the government. So that's what I can cite. I know I have many, but let me, because of the time, I can stop there. But the
Yeah,
building blocks are very, very, very important to have
yeah.
them in place so that at least you can get to the final outcome. Thank you. Over.
Thank you so much, Sylvia. I think you've really touched on important, building blocks that is essential for us to have a thriving digital health ecosystem in Africa, from interoperability to patient identity, ensuring we have connectivity, because if it's digital, it has to be connected, right? And also ensuring we have, data security um, metrics in place, as well as innovation, governance, and intersectoral collaboration that you mentioned. And lastly, you mentioned the workforce development, and saying that, or emphasizing the fact that we still have shortage of normal earth work force. Then now we don't even have digital health experts enough in the country. I think this is one of the things we hope this webinar series is going to help us also bridge, by ensuring our participants who are interested in entering into this industry are able to see that there are gaps and that they are really needed to come in to support the ecosystem. Thank you so much, Sylvia. So I'll go back to Zila now to really ask about, Sylvia has talked to us about the building blocks that we need to ensure we have an ecosystem that is thriving. But I'd like to ask, from your perspective as an investor or someone who analyzes investment, and having also supported many startups and innovation through the I3 program and other programs that Stellent Advisory does, what would you say is the main barrier to scaling digital health interventions in Africa. So as you said earlier, that we have a lot of these applications, these innovations, everybody's just coming up with one or two things. And I think looking at fintech has really scaled a lot. We have so many startups. Can you hear me? Okay, sorry about that interruption. Yeah, so I was saying that looking at fintech that has really scaled, we have a lot of startups that have even scaled to other countries and even other content, but we see that there is a slow adoption or a slow progress in terms of adopting and scaling digital health solutions in Africa. So if you could tell us, from supporting startups and innovation as what you do, what are the barriers you've observed or you've seen in your work?
Okay. I think when people are talking about the growth in the health tech sector, they always use the fintech as an
Fintech.
example. But it's just because I think fintech is a space where we've seen how technology has rapidly led to development. The growth is visible, and it happened at such a rapid scale. But one thing is that even if we take a step back from health tech, healthcare in general is a very delicate sector because you are dealing with human beings and their lives. Like the penalty for failure in healthcare most times is death.
Yeah.
And so this is a sector, I would say, where slow and steady wins the race. Like that proverb stands true. You cannot compare the growth rate in health tech sector with other tech sectors. Growth and maturity takes time. The company I work with, Salient Advisory, and we did an analysis, I think last year, of the 24 leading health supply chain innovators. So this is just a subset of health tech innovators. And on average, we saw they've been operating for like 9 to 10 years, but then their median annual revenues was just like $3 million. And then if you compare that with like other fintech companies, basically, that were founded around the same time, you see those ones having revenues of like over 50 million and the rest. So we have, let's say, minor success stories. I think Kasha was one example that did like 50 million dollars in revenues last year. Was it 2023 now? But based on your question now on what the main barriers are, if I want to start with the basic, obviously infrastructure, we all know internet access, electricity, all of that just adds like extra complications for when you're actually going to implement a digital health solution at a health facility, for example, and even trying to even scale up. These are things you need to consider. So that just has its own, will I say, additional cost that you have to deal with. But then also, one of the questions I would say is one of the barriers, sorry, I would say is accessibility, inclusiveness, and also sustainability. Now, when you think of healthcare in Africa, the population, people that need the support, they are very diverse. We have multifaceted issues. And now you start thinking in this universal health coverage of living goal of leaving no one behind, how do we ensure that we make these digital health interventions accessible to everybody? How do we ensure that in building these digital health solutions, we are not now coming to come and create additional inequalities, health inequalities, So you have to understand the different customers you are building for the rural areas, for the peri-urban, the urban consumers. And now I'm referring to like consumer-facing solutions. There's still the provider-facing solutions where, just as Dr. Silva was talking about, would I say, digital literacy levels of the healthcare workers. He's actually like really, I like the point he brought about how we need actual digital health experts in the field, not using IT officers. Obviously, digital health is a field that welcomes people from different backgrounds, but we actually need people who are well versed with technology and also know how to apply it in delivering healthcare services. Some of the pushback you even get when you're trying to implement a solution, a healthcare provider, they're like, wait, I'll prepare my report. I'll still come on your this thing and come and update result again on the solution. So sometimes there's even this perception of seeing it as an additional level of work on top of their workload. So these are some of the barriers that innovators have to navigate. And even in instances where we've seen innovators trying to do solutions to reach the last mile, like rural markets, I think Copia is an example. They are like an e-commerce. I think they were big in Eastern Africa, Kenya, for example. And they were trying to reach people in the rural areas to be able to get access to medications, on top of what their e-commerce activities. But now we know Copia is in administration now, and no one knows. So managing these expectations of, okay, how do I create solutions that are accessible to all, that are being able to adopt, that my end customers are able to adopt, at the same time still being profitable, is one of the things that innovators have to navigate. We've seen the importance of grants in the space, aid programs. They've helped in like funding successful pilot intervention programs. We see that maybe, for example, mHealth Innovation that is helping pregnant mothers get ANC reminders. And then once that funding is done, what next? Who pays for these services? Do we put the cost now onto the patients who were accessing it basically for free?
For free.
Or is
Yeah.
government willing to pay for this now? Then you start hearing from the government side, oh, we don't have enough budget for this, So also, I would say the low purchasing power among consumers, combined with like limited government budget, also makes like affordability a key challenge. And then we also have broader microeconomic conditions like high inflation, currency instability. And you even mentioned of fintech companies even being able to expand to other countries. We've actually seen some health tech innovators now saying, okay, this country where I am now, the currency inflation rate is kind of like unstable. Maybe I expand to other markets, so I'm able to get Forex to sustain my operations. But there's no evidence yet. But the little risk with that is, if you're expanding to other markets within the African context, okay, similar regional context, But then when we see cases, especially I would say in Northern Africa, where we have innovators in Egypt or Morocco, now going to Saudi Arabia, now you are going outside the continent. So, and if you're any money there, you might be like, let me focus my attention on
Yeah.
where because at the end of the day, it's still business. Your investors are on your neck, to get profitable. But one of the things I would say that investors, donors in general, should understand that growth and maturity in the health tech sector takes time. There are a lot of complexities that innovators are dealing with. There's no doubt about it. Healthcare is a difficult sector. It is a very difficult sector to operate in. But those difficulties, I would say in quotes, are kind of necessary to ensure that we are not just putting out solutions there that will, at the end of the day, will harm people. If you want to look at the Western continent, for example, I think most people heard about Theranos, how big it was, and look at what happened. At the end of the day, she's in jail. And that's also going to people that are thinking of coming to the field. You have to be
Yeah.
careful with solutions, because the end is you end in jail if you do anyhow. So yeah, those are some of the challenges.
Interesting. Thank you. Thank you so much. Such an interesting perspective. Thank you for sharing, the key barriers in scaling digital health interventions in Africa. And, you've mentioned low purchasing power, macroeconomics, unstable markets, digital literacy, workforce capability. So I'll just move from that workforce capabilities to Sylvia to really ask him that, in your view, you've worked on the digital transformation strategy for Rwanda, right? So how has workforce capabilities influenced, the adoption and scaling of digital interventions, in Africa, and maybe using Rwanda as a case in point? Now you are going to the deployment stage of what you do in Rwanda. So far in that journey, how have you seen the effect of workforce capabilities? How has it influenced the adoption or influenced the implementation of digital interventions you've worked on in Rwanda and in Africa in general?
Yeah, thank you very much. I think I have mentioned this even before. Sometimes we sit there and create technologies, and we think because we understand it and because we have got very good skills in using it, we think it is a good solution for everybody. And at the end of the day, if you go to the implementation, sometimes you get different perspective, you get different outcomes. I remember one time we went on the field, and one nurse, just a nurse said, you know, if you are bringing this tool, so for me, I'm going to resign. So
Wow.
he said he's ready to resign because we are bringing a digital tool. So he
Wow.
said, I cannot go back to study this technology. No, I need to go back. I need to go home. So I've not yet gone back to see if he has resigned, but at that time, that one showed me that for me in the office, I was thinking I'm making a very good tool that is going to facilitate the healthcare workers
Mm,
to provide the service. But for them, it is a burden. They see it as a
mm,
burden. So these capabilities that you are talking about is very much necessary, and it goes with the digital literacy. So we need to make sure that these people that we are bringing to them the technology, are they ready? Are they prepared? And preparing them, that's what we call change management. This change management, we never plan for that. We don't plan for that. We think we are bringing a solution and it will be used. And sometimes you are asking your a question, why is it not used? It is a good tool. Why are they not using? But you never prepared them. Of course, you consulted them sometime in the requirement, but they were not prepared like to move and say, okay, you know, I need to have these skills. You need to train them. And we have also got an issue of like these healthcare workers, they are always few. And you to take them out of the service and go and train them, it is also a problem. So you need to have a strategy where you need to train them at work. And
mm,
training them at work, it is also not easy because they are always busy and you will not get them. So I need to emphasize here that even if we are thinking about the technology, but we need to think much about the change management and the implementation and the use and adoption of these technologies, because at the end of the day, we may not get the result that we are expecting. So the capabilities is very low, if I may say, and it is because of the background. It is not because people are not smart enough. It is because of the background. Like here in Rwanda, many people, some nurses have studied in French, and most of the tools that we are creating, they're in English. So you can imagine. So you need
mm,
to teach him the language plus the tool and
mm,
plus the behavior. So there is also a part of behavior that needs to be worked on. That behavior of like telling her or telling him, no, don't worry, it is going to be working. Like today, we have to take our people and they have to sit at the health facility for us for like 1 month. Just telling them, no, 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 don't worry, it is easy. Just click there. Just no, 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 don't. It's and you can imagine for the whole country to get such huge work for the implementation. So that capability is very, very necessary, and in the healthcare providers is needed. So let me go back on the capability for now, the innovators, or on the side of the creation of the tools. We need also capabilities because like in country, if I see, or in Africa, we still have very little experts for some technologies. So I've been discussing with my top leader one day, and he was telling me, but tell me, this software that we are buying from Europe, are you able to do them? That was the question. I said, but these people from Europe, and whatever the world where they are, the codes they are using, it is the same code that we always have on internet. So why can't we make the same systems, the same software, the same solutions? So I was like, we can make them. But he said, no, no, I don't believe you. How can you make, are you having that capability? So you see, we may be having even the capability, but our people do not believe because we have never shown that capability. So for young
mm,
innovators, so it is a very good challenge to show that whatever solution that can be bought from Europe, it can be the same solution you can create while you are in your own country. So, and
mm,
this I know you are able because the IT is general. It's not something that is just one in one part of the world. So
mm,
it's something that you can show that you are able. So these skills, you need some skills. Of course, you need to have the health informatics skills. You need to have the data analytics skills. You need to have uh, data protection skills. So there is some skills that you need to have, so that whatever you are creating as a solution, it encompasses all of those technical skills that you are putting in. Thank you. Over.
Awesome, awesome. Thank you so much, Sylvia, for that input. I think Zila has something to contribute to that.
Okay. Yes. Thanks, Vivian. Thanks, Dr. Sylvia. And when he was speaking about the workforce, will I say their pushback or aversion to adopting digital health technologies, I just remembered, will I say, a past experience that I had in my own example. And so there was this company, but I'll say government agency, we're supposed to deploy a solution from, and when I was talking to, in quote, the previous project manager, he was like, just get ready, like they are not ready for to take whatever solution you're bringing. And so we had our meetings and everything, and I went to the lab, and as I was about to deploy, like I had a conversation with one of the lab managers, and he called me aside. He said, it's not that we don't want to use this solution. We know how to use digital solutions, but we cannot use it. It does not fit our current workflow. And I was like, interesting. He said, sit down, and he told me, just spend a day with me and see how we work, then you understand. I sat down after observing how they carry samples, from when they receive it down to analysis. I myself saw that, okay, truly, truly, we need to go back and make customizations and adjustments to these our solutions. And when we went back, we listened to their needs. We went, redesigned the solution, make the customizations, and we brought it. Later on, once we deployed it, later, I think somebody was coming with a new solution. And they were like, no, 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 don't come and spoil what we have already. There's the issue, yes, of like this pushback from the healthcare workers. There's those issues are there, valid, very point. But there's also this one that is going back to the innovators to know when you are building your solutions, think with your audience in mind. You have to think with your audience in mind, because if you have a good product, most times these medical and healthcare workers are willing to actually use your solution and adopt it in their workflows. So that's something to just have at the back of your mind to make sure that your solutions are also designed with the people that are actually using it. Not just talking to the, will I say, the directors or the top level, but the actual people that will use your solution on a day-to-day basis. So that's my 2 cents on that.
Yeah, solid contributions there. I think I've had similar experiences to when I was working with an AMR company. I was supposed to deploy. They were like, if one button does not work in this AMR, or something does not click, we are not using it again. Like they're already frustrated because of previous experiences with other AMR providers. So I think we still have a lot of work to do. As Dr. Sylvia has mentioned, we need to innovate with the users, even patients, ensure we have that patient input as well into what we have, not just the healthcare providers as well. So thank you so much for that contribution. My last question now, before we start taking questions from our audience, is that, okay, we've mentioned what digital health ecosystem is all about, what are the key building blocks, what are the barriers to scaling. We've also mentioned how workforce capability has really influenced the adoption of these tools. So from both of you, I'm just going to go around. For those who are aspiring, as we said, there are shortage of digital health experts. For those who are aspiring to, become digital health experts, even as healthcare providers who are interested, because we have a lot of them on the call, doctors, nurses, pharmacists, students who are really interested in becoming, digital health professionals and experts. What will you say are some skills they need to get, or what are the skills in demand that they need to acquire to be able to drive this change in their respective space, and how can they position themselves for opportunities? So I'll go to Sylvia and I'll come back to Zila.
Thank you for a good question. Actually, I had that burden of like, if the healthcare providers are being multiplied, so why not digital health? And I've started working with. I think you may be aware that I'm heading Rwanda Health Informatics Association, and this one we have created a program called Digital Health Champions. Digital Health Champion is as the program that takes everyone who is interested to join digital health. So digital health is not something that you need to just do it alone. You can be a nurse with the background, you can be IT from the background, but now you are interested to become a digital health expert. What we do, we just initiate you on the continuous skills that will help you at least to be getting interested and to be introduced to the field. So one of the technical skills that you need in order that you can at least feel that you are in a digital health environment, so you need to have some technical skills, you need to have some knowledge of health, you need to have some soft skills. I will give an example of some, but you need also to gain some practical skills. It depends on which level are you. And you need also to have some certifications, why not? And you need also to have some network. You need to belong to some network. So you should not be alone. You need to belong to some network. Like I think you mentioned about Africa Digital Health Network, or some networks that helps you to grow in your experience of digital health. And then you need also to have, let me go back on the technical skills. You need to understand the health informatics tools, like the electronic health record. What does it mean? What does it do? And if they talk about standards, what are the standards? What does it mean, interoperability standards, HR7? What is FHIR? What does it mean, GDPR? What does it mean, HIPAA? Those kind of standards. So it will give you an idea of like, oh, so where are they applied in health? And then, because we are working with the sensitive sector, we are working with a sensitive data, and this sensitive data, they need to be protected with all of these standards. So you need to have some health knowledge. You don't need to be a doctor. You can be a doctor, yes, because it is your background. But if you are coming from another background, you don't need to study medicine so that you can become a digital health expert. So you can build on top of what you have done as a background, because in health we need everything, we need everyone. You can be coming from another background, but you become a very good digital health as just you are interested. So for some experiences, so I would recommend that people use this way of internship and fellowships. If you are in a company somewhere like Africa CDC or any other company, so it can also shape you, give you an idea of what does it mean, what is it needed in digital health. So you can do some volunteering opportunities. It happens that you can also do some volunteering. These also are very, very important opportunities that can help you to shape your career of digital health. So you need to do some career, I mean academic pathways. I think we totally understand that even if you can get something by experience, but academics also is needed. So there is some good certificates that you can try. You can try to see, like a certified professional in healthcare information and management systems. This is one of them. You can also get some specialized courses on the AI in healthcare. Those courses can help you to understand how can you now build your career in digital health. You need to have to belong to any of the groups. So I said there's different groups, but you need to choose which group can help you to. There's different communities. I can say like OpenHIE community. I can say like FHIR community. Those kind of communities, they will also help you to also get to know what do you need to shape your career of digital health. So you can seek for mentorship. We have some people that are asking for mentorship. We can mentor some people, and we are also, you can also use these online courses, and it can also help you for getting to start getting to health. Thank you. Over.
Thank you so much, Sylvia, for that. Those things you've highlighted, that step by step, skills that interested healthcare professionals could actually acquire to become a digital health expert or professionals, and even those who are not from the healthcare background, that don't have the domain you can still contribute to this field, because as Sylvia has mentioned, it's multidisciplinary. It's not just a one-way thing. We need all hands on deck, really, to be able to move this ecosystem forward. So let me go to Zelia, if she has things to contribute in terms of how can professionals position themselves for these opportunities, and what skills should they aim to acquire. Thank you.
Yeah, just like you said, I think Dr. Sylvie has mentioned most of it, but definitely there are a wide range of opportunities that are available. The digital health sector, I think it caters to diverse skill sets, and so it's accessible to professionals from various backgrounds. I would say the first step, first of all, would be to maybe identify your skill sets, what you currently have, and align it with a role that interests you. So for example, if you enjoy planning, coordination, project management or product might be a good fit for you. If you are more data driven, then data analytics, and even on the clinical side, there are also opportunities for digital health coaching, even being a telemedicine doctor. And once you've identified your area of interest, then you start building like maybe the relevant skills, additional ones, just like Dr. Sylvie mentioned, like learning about the technical tools, the terminologies in the space, gaining relevant certifications and courses. There are so many courses online right now. If I want to, I don't know if if I want to recommend, on Coursera, there's a digital health specialization course. Is a 3-step course. The introduction talks about design and implementing, and then the last one is on evaluating. So that might be a good place to start. But at the same time, attend webinars like this, stay updated, sign up, read articles, newsletters. I would say don't just restrict yourself to just the African health tech, but even the global health tech, so that you are broadening your, will I say, knowledge on what's happening overall at a global level. And yeah, just work hard. If I want to speak from my own experience, my background is in public health. I was in public health project management, and then I transitioned into health tech, and I just focused on project, and now I'm doing consulting, So the industry is constantly evolving, but the key is just remain adaptable, continuously upskill yourself, and then just keep an eye out on emerging opportunities. Over.
All right. Thank you so much, Zelia. I hope you can hear me now.
Yes, good.
Yes.
All right.
Yes.
Thank you so much, Zelia, for the contributions you've made to those points. So right now, I hope we've had a great time. We've been able to learn from the key insights our participants, our panelists have been able to share on the call today. So we've heard from them. So I think it's now time to hear from you, our participants who have joined today's call. So if you have questions, please bring them forward. I would hand over to Oluwatobiloba now to take off the Q&A session. Thank you.
Thank you very much, Lydia. Thank you, everyone. Just to confirm, you can hear me.
Yes, we can hear you.
Good. Thank you, Sylvia. Thanks. You.
Okay, so I think you're breaking a bit, and yeah, so we can't really hear you. So, but then I'll just quickly take some questions that we have in the chat session. So if you have questions, please do raise your hands. So I'll call you to unmute. So let me see if we have any hands raised. So you can use the emoji sign to raise your hands, Delayo. Okay. So you can unmute and ask your question, but let me quickly take this from Adam. I think is it Adam that mentioned this. That how can we integrate a digital health intervention in a health system and how do we make it interoperable? So maybe Sylvia would like to take that. How can we integrate digital health intervention in the health system, and how do you make
Thank
it
you.
interoperable?
Yeah.
Yeah.
Yeah, thank you very much. I think that this question is somehow tricky, but actually, all of our work is to make sure that we integrate digital health in the normal healthcare system interventions. So, we have been feeling like you are feeling not well, you go to the hospital and then they take your symptoms, and then that was the always flow of a patient in a normal way in papers. So whatever we are bringing in as a digital health is to at least make sure that this journey of the patient is not overwhelmed, and it is simplified, and it can also be even done not necessarily being locally at the facility. So this is what we bring in as a digital health. So uh, bringing in the digital health intervention in the healthcare system, that's what it means. It means you take the normal healthcare system and then you try to inject the digital intervention so that it can now help. So I need to make a caution here. So some people tend to just digitize what was in the paper and then it becomes digital. In that case, you are not you are not doing any advancement in what you are doing. So the digital health, bringing it into the healthcare system, it should come with re-engineering. So you bring the solution which can re-engineer the flow that will help at least where it has been like 10 steps, it becomes 1 step, 2 steps, and it does not compromise the outcome. So I think that's what I can say. And how can you make it interoperable? So this is, you need to work according to the standards. Don't be at your home and think and create a solution. No, start from the architecture. So whenever you are building a house that you do not have an architecture, so you are building you are building, but at a given time the door is on the place of the window, and then you will need to destroy. So you need to make sure that if you need the solution to be interoperable, you need to start from the standards. Which standard are you adopting? Which international, the standards, you don't not create standards are international. It is just you to choose to adopt. So I'm using this standard to create this solution. So if this solution is created according to this standard, this will help to be interoperable with whichever solution that is coming after. Thank you. Over.
Thank you. Thank you so much. So one, ensure you adopt standards before you even think of injecting your solution into the system. Okay, so please mute your mic till you are called to unmute. So I hope that answer your question, Wisal. So let's take Tosi. I can see your answer up. Please just go straight to your question. Thank you because of
Okay.
time.
Thank you so much, ma'am, for the panelists. So I'm really having fired up. I just want to find out, or like a request, because this session has really been insightful. I wish to find out if, as a team, it's possible for you to organize maybe uh, a course or a class or something that somebody can follow through, then maybe even get a certification at the end. And then also looking into it, you realize that there are different aspects of tech that one can specialize in. I would really like if we can throw more light. For example, we have data analytics, we have AI. So which one is which? And so thank you. And over.
Okay, thank you so much, Tosi. So for your first question, we do have boot camps. So you can follow Digital Africa online. You can follow Innovated Africa. I think they have a fellowship coming up for African healthcare professionals. And also, Sylvia had mentioned Digital Health Champion from the Rwanda Health Informatics Association. You can also follow, and I think there are lots of capacity building programs coming up this year. So you can just keep in touch and stay updated. I believe you're on the WhatsApp page, so we'll really share all of these opportunities with you. I think I know the link to the Digital Champions program by CVS. I will share with everyone on the WhatsApp page as well, so you can apply or you can register to join and be a part of that program. And there are, as I've mentioned, we do boot camps for healthcare professionals. IHA also has a fellowship for healthcare professionals. So just be on the lookout for such opportunities. And yeah, there are certifications to some of this program. So for the last part, data analytics, AI, we might not be able to delve into it today. We have another session coming up next week where we're really going to go in depth into data analytics for healthcare, AI for healthcare, and every other opportunity, career opportunities available within digital health. So permit me to pen that for next week, because we have a whole session on that so that we can take other people's questions if that's fine with you, Tosi. Thank you. Xiaomi SG03, you can unmute. So we have Xiaomi. I can see your hands on the screen raised. If you have a question, please unmute and ask your question. XIG03, if you're there. If not, I think there's another question in the chat session that says, just give me a moment. Let me read it out. Is digital skills added to the training program of the healthcare workers? So let me ask Xavier, maybe in Rwanda, have you added digital health literacy to your maybe pre-service curriculum, maybe in-service curriculum?
That's a very good question. Actually, it's what we are fighting for. It has not been there. They have a very small course of the ICT, but for us, ICT is not digital health. So that's why we are struggling to get a competence framework, a digital health competence framework, and then negotiate with the universities and the colleges to allow the Rwanda Health Informatics Association to chip in the schools and start providing these digital health competencies. So it's a negotiation, to change anything in the curriculum of the school. It is something that takes long and it is not easy to get approved. But apart from that, so we are doing it aside. Even if the school is not doing it, for us, you join the Digital Health Champion, and then we have developed our own competencies, and then we start from the basic one, and then we will take people until they get to be like experts. So we bring them the trainers, we bring them the courses. We are actually making the platform where all the courses will be shared, and they can run, and then they can be registered. So you will be able to follow your own career guides in that platform. So I will be sharing with all of you the links for Digital Health Champions, and then I will keep you informed on how can we start, what is the basic courses, what is the next, what is the courses scheduled, all of those kind. But we still have also other platforms that gives the academic. I can mention like OpenHI, they have the academics links. We can continue sharing with you all of these links, and then it can help you to grow your knowledge. Thank you.
Absolutely, absolutely. Thank you so much, Xavier. I know WHO has this digital health certification network thing as well, and they are also currently working on the competency framework for digital health workforce capability. So the new things are going on in the background, so we just need to keep updated and stay tuned so that we're able to make use of these opportunities as they come. Lastly, let's take Abraham. A joke.
All right. Thank you so much for the opportunity. My name is Abraham Ajok. I come from South Sudan, and currently I'm in Japan for my master's in public health, and I'm grateful to be part of this webinar today. So, secondly, I would like to appreciate the panel, the speakers. This has been so insightful, and it gives so much knowledge on how to approach the digital health and what you can also do to be an expert and contribute to the need of the Africa region. I have like two questions. First of all, the first one is the issue of confidentiality, which has been one of the major factors contributing to low acceptability of some of the digital health tools, more especially from the policymakers, system users, and the population. So asking Mr. Silva, how has Rwanda been in position to handle such a scenario where rejection of the system comes up? The second question is, have been part of the development of data sharing policies of the IGAD and East Africa community. And our discussion has been on the data sharing policies. But then the member states of the East Africa community and the member states of the IGAD have been having a very low opinion on data sharing. And this was caused by the data security issues, the privacy, and also looking at the interoperability layers. So what would be your advice in such a scenario? Because most of the experts or most of the people that are looking into digital health now would be will also face the challenges later. So can you give some advice on how it can be approached? And thank you so much. I appreciate.
Thank you. I think those are very good questions. If you allow, I think I can start by the confidentiality one. Yes. I need to ask also the question while I'm answering a question. I know it's not a good way of answering, but if we have papers, so how do you ensure your patient file confidentiality at the facility? So if you can ask me, for example, how do I ensure my the security of my medical record at the facility while it is in paper? So it's very hard, sometimes, which is not a best practice, but some doctors can send some archive or some people who are not doctors to go in the archive and bring your file. I don't know if it has happened to you, but it happens. So you can imagine, we don't know this person, but we are sending him to bring a patient file. So he can copy anything. He can take a picture of anything. And then you can be one day in a newspaper that you have been having A, B, and C as disease. So this is actually, we are coming from zero confidentiality. When we are making this digital, at least we are able to know where is your medical record, and then we can start applying some protection measures according to what the technology is offering. And at least we can be able to tell you, you know what, Dr. Silver has access to your medical record on date A and at this time, and he has accessed this through maybe from which facility. And then in this time, we are at least giving you even the chance to claim your right. So the confidentiality is growing. So it is like we are coming from zero and then we are going to one. It does not mean that we will solve all the issue of confidentiality, but for us in Rwanda, so we had a chance of like our people are more like understanding the digital quickly. So I can say they are digital oriented. And then when we explain that things are coming from paper to digital, so they believe in digital than papers, and we could explain and then they understand, and we totally understand that the confidentiality is not going to be just solved by digital. It needs also more frameworks that need to protect those digital data. So for us, we do not have this issue of acceptability for the confidentiality, but we take care of this as an issue, and we have Rwanda National Cyber Security, which is an institution that is there for making sure that whatever system that is being recording medical record, it has to be certified that it has the minimum measure of security for keeping the confidentiality of the data of the patient. So let me come back on data sharing between countries. This is a very huge issue. Actually, sometimes I may not allow to share the data because I don't have them, or I don't know how can I do it, or how I am not sure if I will be ensured that if I exchange, I'm okay, I'm secured. So this is also an issue of standard. It is an issue of standard where all countries needs in their internal settings, they need to make sure that at least the patient data is streamlined. So I don't know if there is any country where you will get a patient who is unique at the national level. It's not easy to get one. So if you are asking me, a country A, you are asking me to share patient data to you as a country B, and my patient data is scattered and I don't have them in a well-arranged manner. So in that case, I will bring all the constraints so that I will not be able to share. So what we are doing, I've worked on with Smart Africa. I don't know if you know Smart Africa, but this is uh, a non-governmental organization, but it was created by African Union. It has already 39 member states that has adopted working with Smart Africa. So we have created a blueprint. A blueprint means what? It is just a guideline that shows you if you need to exchange data from your country to another country, there is something that you need to do internally. There is A, B, C, D that you need to do before you start thinking of sharing. And that includes the unification of patient. It includes also the infrastructure that secure your data confidentiality and all of that. So I think I have a hope that with this blueprint that is going to be launched in the Transform Africa Summit, so this blueprint is going to help all countries to be able to exchange data in the confidentiality manner. So I think that's what I can say for now. Thank you for good questions.
Thank you so much, Dr. So.
Thank you so much, Dr. Sylvia, for that. You took your time to really give a very solid explanation on that question. Thank you. So thank you so much, everyone. So lastly, I'll just let our panelists just give us what's it called? A closing remark. What is one word or one sentence you would like to share with the aspiring digital health experts or professionals who are interested and passionate about coming into this space? So I'll start with Zila. So let's hear your voice again, and let then after that we'll hear from Dr. Sive.
Yes, thank you so much for having me. For me, I would say personally, working at this intersection of health and technology has been a very fulfilling journey. It's been interesting to just see how the space has continued to evolve. I would say that health tech in Africa is still a fairly nascent, is still at a fairly still nascent stage. And so if there's been a time for you to join, I would say now, because as the industry continues to mature and even things talking about workforce development, so grateful for the kind of questions that even came in. The one of saying, digital health skills be included in like maybe healthcare workers curriculum. I mean, these are opportunities. That goes to show you that there's still a lot of things that need to be done in this field. And that just means that there's so many opportunities for everyone. So just take your time. Like I said, identify your skill set, build yourself, identify the opportunities, stay updated on what's happening. When you hear that, this country, this is a strategy document, read it, go to see what's happening, and then see places where you can like basically fit in. The world is big enough for everyone, and we'll continue needing more support in this field and more hands. So I hope you stay to the end of the webinar. For you to even join a platform like this shows your seriousness, and just continue working hard on that, and time and chance happens to all. So thank you.
Thank you. Thank you so much, Zilia, for those inspiring words. So let's hear from Steven now.
Thank you very much. I think for the very good innovators who want to join, please come on, because this is like the space that for me I consider that it still need more workforce, it still need more innovators, and I think you will all be happy if you do something for your own, for your uncle, for your mother, for your sisters. So that's what I like in here. So it's like whatever I'm doing is for myself. If I'm talking about the data privacy, I'm talking about it's not for someone else, it's for me. So you will be always happy if you produce something that is benefiting you as you, it is benefiting your mother, it is like I'm giving back to my community. It's like you are giving back to your community. So I will call upon all people that needs to join the space. The space is a very good one. Of course, it will not be easy. And one time Jesus said, I did not promise you that everything will be easy, but it is feasible and it is good and it will reward you because it is all about you and your family and your loved ones. Thank you. Over.
Thank you. Wow, that's such an heartfelt remark. Having and don't get too carried away by tech and innovation. Like at the core of everything is still healthcare, right? And healthcare, it's something that touches everybody, yourself, your parents, your family, and all. So adding innovation into it even makes it, more accessible, more cost effective, and more closer to those who need it. So it's not just a thing of maybe it's a profession. I'm just taking it as a profession, as a job. It's actually a life saving endeavor you're going to go on as someone who is pursuing something in digital health. And we need more of you. As you've all mentioned, you've heard on the call today, we still have shortage of digital health experts, innovators, and all. Our problems are still a lot. And I believe in the problems are opportunities to actually innovate. So thank you, everyone. A warm appreciation to our panelists today who have taken their time to share insights, experiences, and advice with us today. This discussion has really empowered me again and reignited the fire in me, to contribute to the Africa Digital Health ecosystem. And I hope you've been able to learn that you are needed, your skills are needed to be able to ensure this dynamic space thrive. So to all our participants, thank you so much for joining us. Remember that this is just the beginning of the webinar series. We still have more series coming. So by next week on the 21st, we have a session on CV and LinkedIn optimization, because CV, as mentioned, you need soft skill, you need technical skills, you need networking, you need opportunity, you need everything you need to get to be able to be well positioned to make impact in this digital health space. And we believe for someone who is just launching a career, you need your CV to be optimized so that you can be able to get potential employees or opportunities, fellowships, and all of these things to help you your career growth. And one platform we always advocate for early career stage professionals or even professionals to be on is LinkedIn. And I think even to bring our speakers on board today, LinkedIn was what we used to even interact with them. So you could see the importance of LinkedIn. So we are also we have also dedicated a session, a practical session to help you polish your LinkedIn so that you can attract opportunities, you can attract employees, you can attract key opportunities that will really help you grow in your career. So come next Tuesday with your CV, with your LinkedIn profile. We have a session and the speaker is going to walk you through the nitty-gritty of polishing it so that you are well positioned for a lot of opportunities within the digital health space. After that, we have what we call a digital health career fair. So a career fair is where you'll be exposed to different careers within the digital health space. We have AI in healthcare session, we have a data analytics session, we have a bioinformatics and genomics session, we have a product development session, we have even those who are interested in working with NGOs and CSOs. You want to work with Bill and Melinda Gates, Gavi, Africa CDC, you want to work with Clean Access Initiative. We have somebody from these organizations who are going to come and speak to you about how to position yourself to be able to work with this kind of organizations. We have a startup entrepreneur coming as well to talk to you how you can build a digital startup, how you can innovate. Right. So many things are still upcoming within this webinar series. So please do join, get your friends to join, get your colleagues to join. We need everybody on board, as we've said so far. So thank you so much. We're just starting. Please stay and attend the rest of the webinar series and make the most of the networking opportunities. As a good friend would say, your next $10,000 gig might be sitting on that WhatsApp page. So please network as much as possible. Share what you've learned today online. Talk about it. Share your LinkedIn URL. Let's connect with each other. Share opportunities, and let's shape the future of healthcare in Africa. Thank you so much, all. Thank you, everybody. See you at the next session. Thank you so much. Bye.
Thank you. Bye bye.
Bye bye.
Bye.
Thank you
Okay,
so much.
bye bye everyone. Thank you.
Bye.
I hope you can get this video link later. This recording.
Yes, so we're live streaming. You can go to YouTube, Digital Health Africa channel, and you'll be able to watch this all over again.
All right, thank you so much.
Thank
Have a nice
you. Thank you. See you next session. Come with your CV, come with your LinkedIn. We also have personalized CV review for 5 people, 5 lucky people who will sit with you and review your CV and polish it for you, personalized, not general session. So there's still a lot to unlock. Thank you so much.
Thank you so much.
Yeah, bye. See you next call.